Well, there are some things that we do that we may take for granted, like getting out of bed in the morning, talking, even swallowing.
Yeah, but for people who have experienced traumatic brain injury, being able to do those things that come naturally to so many of us can be difficult. But Ashley is learning this morning. A team at Rochester Regional Health is making those things possible again for some pretty inspiring patients.
Good morning. We've talked to you a little bit. We were showing you different kind of ways. Now, people might think of a brain injury. They think of automatically you might forget how to walk. You might not remember how to do that. And this is one of the ways that you guys are helping. Jason, explain what I am in right now.
So this is the Vector system from BioNest. So it's a body weight support system that allows us as therapists to take some body weight from the patient when we're working on things like walking, balance, strengthening exercises, and give some support and confidence to the patient.
So this has how much weight is lifted off of me right now?
So currently you have 15 pounds being dynamically supported on this machine.
Nice, nice. So it makes it just lighter, less weight when you're, you said maybe getting up for the first time.
Yeah, so it allows us to be aggressive in our treatment sessions with our patients, especially those that are getting up for the first time. They might kind of lack the confidence.
Yeah. So, what do you typically do when somebody comes in here and they're in the BioNest?
Yeah. So sometimes it's working with patients. Often with brain injury, they might have weakness in one or both of their legs, so it allows us to get them up in a safe and confident manner. It also could be a patient that we're working with brain injury that's very high level, that's walking and doing well, but might just need some work on balance and kind of fine tuning those things.
Okay. So should we go down? You've got a little kind of obstacle, if you will, set up for exercises. So I'm just good to walk.
Yep. We'll just start walking.
Okay. Is this fast, slow?
Yep, that's pretty good. So now you can actually speed up your pace a little bit.
Okay.
And the machine is supporting you.
Wow.
And now you can actually bring it down to slow motion. So you can work on walking, changing speeds, slow and fast.
Wow. And you can go backwards as well. It helps you with being able to walk backwards, too. Yeah. Okay. Yep. So what will I be doing when I get to these now?
So here, what I'll have you do, actually, is you come up to this first step. You're going to step both feet up to the top of the step and then down the other side.
Okay. And this might be something that many of us would do it again?
Correct.
Would take for granted, but how important is being able to walk and maneuver?
Right. Well, as you said, it's something that it's one of the things that patients here with brain injury, they want to recover the most. It's one of their primary goals, getting home, recovering their walking, and this is definitely a machine that allows us to do that earlier on and more aggressively.
Yeah, so step over these ones then?
Yeah, so we're going to step over with both feet, and then same with this next one. Okay, now the other thing this machine can do is we can use it to help you come down into a kneeling position.
Okay.
So if you come down onto one knee, you can feel the machine supporting you while you're doing it. Yeah.
And then two?
Yep, and you can come into two. Now another way to strengthen in this position, so if you come into a squat in this kneeling position, is come down and then come back up tall on your knees. So we can do different reps with that.
Yeah.
So as you're doing all these activities, this machine is continuously providing that body weight support for you.
How crucial is this in recovery? And when we're talking Brain Injury Awareness Month, how crucial is being able to do this in recovery?
Yeah, so it definitely allows you to do things that potentially you might not be able to do, without that body weight support.
Wow. And when you've been working here, you said just about 3 years now.
Yeah.
What is the most rewarding part of your job?
I really think it's being a part of that team with getting people back to the things that mean a lot to them. So it could be returning home, returning to school, returning to their jobs, returning to playing with their kids and being part of their family again. Those things often, at least initially, brain injury are often lost, and we're part of that rewarding team to help people get back to the things that are meaningful to them.
And to have this much, I mean, this is amazing to be able, we take for granted walking out of a door every day, and we were seeing the different things with swallowing and different cognitive skills. To have this here and to have this as an option for folks and to help them, how important is this that you guys are here doing this?
Yeah. So one of the things that our patients have difficulty with often is supporting their weight on their legs. They could be able to walk and actually support their weight, but just losing that ability to correct themselves when they lose their balance. So one of the things that the research kind of shows is that to really develop balance, the patient needs to be able to experience that loss of balance and start to work through it themselves, how to recover from a loss of balance. So this allows them to do that in a safe way.
I mean, yeah, look at, you can be able to It'll catch you if you fall.
Yeah.
But yeah, we have learned so much here this morning and seeing all the different ways and all of the different, the rehabilitation that is here and bringing in awareness to it during Brain Injury Awareness Month and seeing, I mean, you're talking to Chris. Look how amazing he's come, and he says he's got a lot of work to do yet, but these folks here have really helped him, and he can continue to. So lots of great stuff here.
Yeah, Ashley, thank you so much for telling this story, because every once in a while I'll meet someone who this is their job, and you hear that, you know, they can't really talk much because, you know, of HIPAA rules, but you get a little taste of what they're doing. And I've like, always wanted to go and do news stories there. So Ashley, thank you for shining that light on this incredible place.